Hi everyone, I am Dr. Happiness. This morning I'm in the lab to run my annual health check. Good morning, Miss Eunice.
Good morning, ma'am.
I am here to do my annual health check. What are the tests recommended for me?
Okay, you can sit, ma'am.
Thank you.
Yes, ma'am. You're going to be running about 8 tests, which are full blood count, fasting blood sugar, total lipid profile, kidney function test, liver function test, vitamin D screening, and thyroid function test.
Okay.
Yes, ma'am. Here are the equipment I'm going to be using for the procedure. This is a machine, we call it glucometer, and the strip which we are going to be using for the fasting blood sugar. And this is a sterile vacuum tube. We are going to be using it for the lipid profile test, kidney function test, liver function test, vitamin D screening, and thyroid function test. This is an EDTA container. We are going to be using it for the full blood count. This machine is the chemistry analyzer. I'm going to be using it for the total lipid profile, kidney function test, liver function test, vitamin D screening, and thyroid function test. This is a hematocrit machine. I'm going to be using it for the packed cell volume, which is part of the full blood count. This is my normal counting chamber and the microscope, which I'm going to be using for the WBC counting.
How about the platelet count?
The platelet count is still going to use the microscope for it. These are my blood collection equipment. This is a 70% alcohol. I'm going to be using it for disinfection, and this is my sterile cotton wool. I'm going to be using it after the blood collection to stop the blood from flowing. This is the 2mm syringe, which I'm going to be using for the collection. And this is my tourniquet. I'm going to use it to tighten her hand to make her veins prominent.
Okay.
Yes, ma'am.
So, I steady my hand here.
Yes, ma'am. So, ma'am, you're going to
Squeeze my fingers.
Yes, ma'am.
Palm. Okay.
All right, ma'am. So, I'm going to use my 70% alcohol to disinfect the area. So, this is my sterile control and 2mm needles and syringe. Okay. Okay.
That's all.
Yes, ma'am. All right, you're welcome to our lab.
So you can see, done. In less than 2 minutes, I will have the full report of what's going on inside my body. And if I've not done my HPV, I should add it now. For men above 40, 45 years, you should add prostate-specific antigen to your test. Full blood count tells you about how much blood you have and if there's infection in your system, because they're going to do PCV, WBC count, platelet count as part of the full blood count. The platelet count tells you about how your whether you're thrombocytopenic or whatever. If you have a bleeding problem, platelet count will tell you that. If you're susceptible to infection, WBC count will tell you. If you're anemic, your PCV will show. All this information you get from full blood count. And the kidney function test, the test she's going to run is urea electrolyte and creatinine. It tells you about how well your kidneys are working. The liver function test tells you about the state of your liver. And your total lipid profile tells you how much cholesterol you have in your body, the total cholesterol, the high density lipoprotein, the low density lipoprotein, and the triglyceride. So it's not even enough for you to have a knowledge of your total cholesterol. You should have the full lipid profile. That will give you a picture. And especially if you're hypertensive or diabetic, or you're on the big side, I mean you're obese, it is important. Though there's a misconception that if you're fat, your cholesterol level is going to be high. That's a misconception. I've seen a lot of skinny people that have abnormally high cholesterol level. So whether you're fat or you're slim, you should have your annual health check. Check your total lipid profile at least once in a year. You check your blood sugar, because if you're diabetic or you have a family history, you even need it more. And if you're not diabetic, you need to know, so that if your sugar is rising, you control it. It tells you whether you're pre-diabetic or you're diabetic or you're normal, so that you know how to manage your diet and lifestyle. So these tests are important. Surprisingly, a lot of people, even in sunny environment like tropical areas, have low vitamin D levels, because most times we go from house to car, we don't expose ourselves to the sun at least for a few minutes in a day. So most people come down with low vitamin D level. Vitamin D tells you how strong your bones are functioning and even your immune level. How about thyroid function test? I'm also running thyroid function test, because especially in women, sometimes you're depressed, sometimes you're adding weight, you're losing weight, it could be your thyroid. So you need to check your thyroid function. It's important we run all these tests to ascertain how well our body is working. At least once in a year, do an annual health check. A stitch in time saves 9.